Your blood pressure does not have to keep climbing just because the calendar does. And the research on this has honestly gotten a lot better in the last few years. In this video, I want to give you 3 specific exercises that have the strongest evidence behind them for actually lowering blood pressure in older adults, along with the exact protocols that the studies used. And along the way, I want to show you why some of the exercise advice you've heard might be leaving real points on the table. Before we get into it, if you find this useful, please subscribe to my YouTube channel for evidence-based health guidance every single week. And as always, even though I am not your physician, so please talk to your doctor before starting anything new, because this video is educational only and not medical advice. So let's get into it. Why exercise is one of the most powerful tools you have. When most people think about lowering blood pressure, they jump straight to medication. And medication is important, but it is not the whole story. The 2017 American College of Sports Medicine position stand and the more recent 2021 scientific statement from the American Heart Association both describe exercise as a first-line therapy for elevated blood pressure, right up there with what you eat and how much you weigh. Sources: ACSM/ACSM position stand, AHA scientific statement. And the reason is simple. Exercise actually changes the biology of your blood vessels. It improves how your endothelium, which is the lining of your arteries, makes nitric oxide. And nitric oxide is the molecule that tells your vessels to relax. It also tends to lower your resting sympathetic tone, which is the part of your nervous system that keeps blood pressure cranked up. And over time, it can even reduce stiffness in your arteries, which is one of the main reasons blood pressure creeps upward as we get older. Now, here's the part that surprised even me when I first read it. In the largest meta-analysis ever done on this topic, published in the British Journal of Sports Medicine in 2023, the researchers pulled together 270 randomized controlled trials with over 15,000 participants. And they ranked every common exercise mode by how much it actually lowered blood pressure. The verdict was, frankly, a little counterintuitive. The 3 exercise modes that ranked highest were not the ones you see advertised on gym signs. They were isometric exercise training, combined training, and dynamic resistance training. And the differences between modes were meaningful, not just statistically. So instead of giving you generic, just walk more advice, I want to walk you through the 3 exercise modes that have the strongest evidence right now for lowering blood pressure in people over 60. And for each one, I'll give you the actual dose the studies used, plus the cautions that matter more once you are past a certain age. Number 1, isometric exercise, the unexpected winner. This is the exercise type that almost nobody talks about in regular fitness circles. Yet it tops basically every meta-analysis I have seen. Isometric exercise is when you contract a muscle and hold it without changing the length of the muscle. The classic examples are the wall sit, the plank, and the hand grip squeeze. In the 2023 BJSM Network meta-analysis, isometric exercise training had a 98.3% probability of being the best mode for reducing systolic blood pressure, which is the top number. The pooled reduction was about 8.24 millimeters of mercury systolic and 4 millimeters diastolic. Now that is a big drop. We are talking about reductions similar in size to a single low-dose blood pressure medication, achieved with no pills. And the reason this matters for you, even if you have never heard of isometric exercise before, is that these exercises can be done safely at home, in a chair, against a wall, with a small grip device that costs about $10. You do not need a gym membership, and you do not need to sweat. Let me give you the 2 isometric protocols that have been most studied. The first is the wall sit. You stand about 2 feet from a wall, slide your back down until your thighs are parallel to the floor, and hold that position. The studies used 4 sets of 2 minutes each, with 2 minutes of rest between sets, done 3 times per week. Over 8 weeks, systolic blood pressure dropped by an average of about 10 millimeters of mercury in adults with hypertension, and the effect was most pronounced in people who were already on medication. Now, for someone over 60 with knee issues, a full wall sit might not be realistic, and that is fine. You can do a modified wall sit where you slide down only halfway, or you can hold the position for shorter intervals, like 30 to 60 seconds, and build up gradually. The principles still apply. The second option is the isometric hand grip device. This is a small, spring-loaded tool you squeeze and hold. The protocol studied most often is 4 sets of 2-minute squeezes at about 30% of your maximum voluntary contraction, with 1 minute of rest between sets, 3 days per week. Over 8 to 10 weeks, systolic blood pressure drops of roughly 7 to 9 millimeters of mercury have been reported, even in older adults with hypertension. And I will be honest with you, the first time I read about hand grip training raising blood pressure concerns, I was skeptical. After all, you are squeezing something while you have high blood pressure. Would that not be risky? But the research has been reassuring. During the actual contraction, blood pressure does rise briefly, but the after effect, that sustained lower resting blood pressure afterwards, is what produces the long-term benefit. The mechanism here is also interesting. When you hold a muscle contraction for a sustained period, it compresses the local blood vessels. When you release, you get a rebound rush of blood flow, which improves the function of the endothelial lining and increases nitric oxide availability. Over weeks, this retraining of your arteries appears to be one of the main drivers of the blood pressure drop. So, for the over 60 crowd, my practical recommendation is to start with either a hand grip device or a modified wall sit 2 to 3 times per week and build up gradually as tolerated. Number 2, brisk walking, the underrated workhorse. Now, isometric exercise might be the headline winner in those big meta-analyses, but walking is still the workhorse. It is the most studied, the most accessible, and arguably the most sustainable form of exercise for older adults. In the 2013 Cornelissen meta-analysis, which is one of the foundational papers in this field, aerobic exercise training reduced systolic blood pressure by an average of about 3.5 millimeters of mercury and diastolic by about 2.5 millimeters of mercury, with the largest reduction seen in people who already had hypertension. More recent data from a 2024 study looking specifically at brisk walking in older adults with hypertension showed that 60 minutes of brisk walking 3 times per week for 12 weeks produced significant reductions in systolic pressure. But there is a difference between walking and brisk walking, and that distinction matters. Casual walking, the kind where you can hold a full conversation without breathing hard, is wonderful for general health, but it is probably not enough on its own to produce the kind of blood pressure reductions we are talking about. You want what exercise physiologists call moderate intensity, which means you can still talk in sentences, but you cannot sing. Your heart rate is roughly 50 to 70% of its maximum. And the dose that seems to produce the most consistent results, this comes straight from the updated ACS-MFITT recommendations for adults with elevated blood pressure, is 20 to 30 minutes per session, ideally on most days of the week, accumulating 90 to 150 minutes per week. Now, here is the practical piece that I think often gets missed. The blood pressure lowering effect of a single bout of aerobic exercise only lasts about 24 hours. So if you walk briskly on Monday and then do nothing until Thursday, you have lost most of the benefit. That is why frequency matters so much, even more than duration on any single day. 5 20-minute walks will almost always beat one 100-minute walk for blood pressure control. For someone over 60 who is just getting started, I usually suggest a ramp-up plan. Week 1 and 2, just walk at a comfortable pace for 15 minutes a day, 3 days a week. Week 3 and 4, bump it to 20 minutes 4 days a week. And by week 6, you should be at 30 minutes most days, ideally at a pace where you are slightly out of breath but not gasping. And if weather or joint pain is an issue, a stationary bike, an elliptical, or even walking in a pool all count toward the same aerobic exposure. Number 3, dynamic resistance training, the underused tool. The third piece of the puzzle, and the one I think gets neglected the most in older adults, is dynamic resistance training. But this is not about heavy bodybuilding or lifting massive weights. This is about structured strength training using moderate loads. In the 2017 D'Souza meta-analysis of dynamic resistance training alone, systolic blood pressure dropped by about 8.2 millimeters of mercury and diastolic by about 4 millimeters of mercury. And a 2023 meta-analysis focused specifically on older adults showed similar reductions of roughly 7 millimeters systolic and 4 millimeters diastolic, with particularly strong effects in prehypertensive and hypertensive older adults. Now, why does resistance training lower blood pressure? The mechanism here is partly about improving how your body handles glucose and insulin, partly about reducing arterial stiffness, and partly about something called the muscle pump. When larger muscles contract against resistance, they physically push venous blood back toward the heart, which improves overall circulation and reduces the workload on your cardiovascular system over time. The evidence-based protocol for older adults is moderate intensity, meaning loads that feel like a 6 or 7 out of 10 effort, 2 to 3 days per week, with 1 to 3 sets of 8 to 15 repetitions per exercise. The key exercises that have been most studied for blood pressure benefits are compound movements that use large muscle groups: squats to a chair, leg presses, chest presses, rows, and overhead presses with light to moderate dumbbells. For someone over 60 who might be dealing with arthritis or balance issues, machines are often a safer starting point than free weights because they guide the path of motion. Resistance bands can also be a great option. They are inexpensive, portable, and they let you scale the intensity very gradually. And I want to flag one important safety nuance. Heavy isometric loading, like holding a very heavy weight still in your hands, can spike blood pressure significantly during the actual hold. So the goal in dynamic resistance training is movement. You want to keep the repetitions flowing, avoid breath holding, and breathe normally throughout. That one simple cue can make the difference between a beneficial session and a risky one. What about combining all three? Now, you might be wondering, can I do all 3 types together, and is the effect additive? This is where combined training enters the picture. Combined training refers to performing both aerobic and resistance exercise within the same week. And in the 2023 BJSM meta-analysis, combined training had the second highest probability of being the best mode for blood pressure, with a systolic reduction of about 6 millimeters of mercury. So the answer is yes, layering these 3 modes makes sense. A practical weekly plan for someone over 60 might look something like this. Monday, 25 minutes of brisk walking plus a 10-minute isometric hand grip session. Tuesday, a 20-minute resistance training session covering all major muscle groups. Wednesday, rest or gentle stretching. Thursday, another 25-minute brisk walk plus wall sits in 30-second intervals. Friday, a second resistance training session. Saturday, a longer 40-minute walk at a comfortable pace. Sunday, full rest. That is a reasonable starting structure, and it hits all 3 of the modes that have the strongest evidence. But let me emphasize something important. You do not have to do all of this from day one. The biggest predictor of long-term success is consistency, not perfection. So pick the 1 or 2 pieces that feel most doable, build those into a habit, and add the others gradually over a few weeks. Safety considerations that matter more after 60. Now, let me turn to safety, because no list of benefits is worth anything without the corresponding cautions. There are a few rules of thumb I share with every patient before they start a new exercise program with high blood pressure. First, do not start a new vigorous exercise program if your resting blood pressure is above 200 systolic or 110 diastolic. That threshold is in the guidelines for a reason. Talk to your doctor first. Second, if you are already on blood pressure medication, and especially if you are on a beta blocker or a diuretic, exercise can amplify the blood pressure lowering effect. This means you should pay attention to how you feel during and after exercise, especially when you first start. Dizziness, lightheadedness, unusual fatigue, or near fainting are all signs to slow down and reach out to your doctor before continuing. Third, isometric exercise specifically causes a brief rise in blood pressure during the actual contraction. If you have uncontrolled hypertension or a history of certain cardiovascular events, your doctor may want you to start with shorter holds, lower intensities, or even skip isometrics initially and focus on aerobic and dynamic resistance work. Fourth, breathing matters more than you might think. Holding your breath during any kind of exertion, what is called the Valsalva maneuver, can spike blood pressure dramatically. So during wall sits, hand grip squeezes, and especially during resistance training, focus on steady, rhythmic breathing. Exhale during the effort phase, inhale during the recovery phase. And fifth, hydration and environment. Older adults have a blunted thirst response. So drink water before, during, and after exercise, especially in warm weather. And if it is very hot or very humid outside, take that walk indoors instead. Common mistakes that quietly reduce your results. I want to walk through a few common mistakes that I see all the time, even in motivated patients. And I have made some of these myself early in my career, so I am not throwing stones here. Mistake number 1 is treating exercise as a one-time event. Because the blood pressure benefit only lasts about 24 hours, a weekend warrior approach where you cram all your activity into Saturday and Sunday is far less effective than spreading it across the week. Think of exercise for blood pressure less like going to the dentist for an annual cleaning and more like brushing your teeth every day. Mistake number 2 is measuring at the wrong time. If you check your blood pressure right after exercise, it can be artificially low or artificially high, depending on the type of exercise. The most informative time to measure is first thing in the morning before any activity and again at night before bed. That gives you the trend over weeks, which is what actually matters. Mistake number 3 is giving up too soon. The studies that showed the biggest blood pressure reductions generally ran for at least 8 to 12 weeks. Many people start an exercise program, do not see changes in their home blood pressure readings after 2 weeks, and decide it is not working. But the biological adaptations in your vascular system take time. Give it at least 8 weeks before you judge the results. Mistake number 4 is skipping strength work because of fear. I have had patients in their 70s and 80s who are afraid to lift anything heavier than a soup can. And I get it, the messaging around strength training for older adults has historically been confusing. But moderate resistance training is not only safe for most older adults with controlled blood pressure, it is one of the most reliably beneficial things you can do. The psychological and quality of life piece. Now, one more thing I want to touch on because it often gets left out of these conversations, and that is the quality of life piece. Exercise is not just a numbers game. The same brisk walking program that lowers your systolic blood pressure by 5 millimeters of mercury is also improving your sleep, your mood, your balance, your glucose control, and your cognitive function. In fact, for older adults specifically, the combination of aerobic and resistance training has some of the best evidence we have for slowing age-related cognitive decline. And we are now seeing data that the same endothelial improvements that lower blood pressure are also improving blood flow to the brain. So even if your blood pressure numbers do not move as dramatically as the studies suggest, you are almost certainly getting benefits that do not show up on the cuff. Putting it all together. So here is what I would recommend as a starting framework for an over 60 adult looking to lower blood pressure naturally. Step 1, establish a baseline. Get a validated home blood pressure monitor, take readings in the morning and evening for a week, and share those numbers with your doctor. This becomes your anchor. Step 2, add brisk walking most days of the week. 20 to 30 minutes at a moderate pace where you can talk in sentences but not sing. Build up gradually over 4 to 6 weeks. Step 3, layer in a simple resistance training routine 2 to 3 days per week. Body weight or band-based, focusing on squats to a chair, rows, chest presses, and core work. Keep the loads moderate and the breathing steady. Step 4, add isometric exercise in short doses. A 10-minute hand grip session or modified wall sits 3 times per week is enough to start. You do not need to do heroic holds. Step 5, track and adjust. Recheck home blood pressure in 4 to 6 weeks and share those trends with your doctor. If your numbers are not budging, you may need a medication conversation, and that is a perfectly reasonable next step. Exercise is powerful, but it is not a substitute for medication when medication is needed. The honest bottom line. I want to close with something honest. Exercise is one of the most powerful, evidence-based, and underused tools we have for blood pressure control in older adults. The data is now strong enough that it should be a first-line recommendation alongside diet and weight management, not an afterthought. But it is also not magic. There will be people for whom exercise alone is not enough to reach a safe blood pressure target, and that is okay. The goal is not to avoid medication at all costs. The goal is to combine every tool we have, including exercise, in the smartest way for each individual. So, what I would love for you to take away from this video is this. The 3 exercise modes with the strongest evidence are isometric training, brisk walking or aerobic activity, and dynamic resistance training. Any one of them will help. Combining all 3 will likely help the most. And consistency across the week matters far more than intensity on any single day. I hope this was helpful. Stay healthy, and I'll see you in the next one.